On this National Healthcare Action Day, we want to put the word out that the system is broken.
Our system is broken.
The system has been broken.
The system is broken.
The system is broken.
The system is broken.
We've seen healthcare workers across the country be forced to work in unsafe conditions and then be threatened and punished for speaking out.
This past weekend at work, I heard from lots of nurses about how hectic and short-staffed nurses are throughout the hospital, from the emergency room to the ICUs to all the units that have been converted to COVID-19 units.
In 2019, 4 New York City hospitals refused to hire the 3,600 nurses needed to provide safe staffing to our communities. 1 year later, these same hospitals begged nurses to come out of retirement to staff this pandemic.
I'm at home at the end of a 7-day quarantine for symptoms of COVID-19. I'm one of the lucky ones. Many of my coworkers have been much sicker than I. Some have been hospitalized. Some nurses and doctors have died from this. And many people out in the communities have died from this.
Healthcare is a human right, as stated in the United Nations Universal Declaration of Human Rights. The U.S. should have never built a health insurance system for the purpose of billing and making profits.
We have also seen the for-profit healthcare system completely exposed. The virus is shining a light on the fact that the system has always put accumulation of profit over patient health, and it continues to do that today.
We need a system in place where everyone is treated fairly, with dignity, and sane, with the equipment we need to protect our patients.
Health in this country is based on a health insurance system that has never worked in the benefit of all Americans and is definitely failing us during this pandemic, especially as minorities.
The racism inherent in our for-profit healthcare system has led to a disproportionate number of fatalities in communities of color. 34% of deaths in New York City related to COVID-19 are Latinos. 28% are Blacks.
And even before the crisis, the disparities and the lack of, health equity has always been an issue. It's just that now we're seeing it so clearly. And for myself as African American woman, I see it all the time in my community. I'm from the Bronx. Well, I'm from Spanish Harlem and I live in the Bronx, and you see it all the time, the disparities that are affecting everyone.
There are millions of unemployed because of this crisis. We could put them back to work doing the testing, the contact tracing, providing the food, the laundry. We could put them back to work making the masks, the gowns, the face shields, the ventilators.
And we still do not have an adequate national testing program.
At the floor of our demand should be a national improved Medicare for all system. That should be the very basic thing that we should be demanding for, and what we should get living in a society that allows people like Jeff Bezos to exist. What we ultimately need is we need a nationalized healthcare system put under democratic worker control.
We need to unite, organize, and fight.
I want to invite you to join us this Wednesday, April 15th, for a National Day of Healthcare Action to raise awareness about what's actually happening on the front lines right now.